PTSD and/or mTBI among veterans by Townsend Meredith. So my question is, what are the effects of PTSD and/or mTBI among veterans, and how effective are the treatment options? In addition, are there any proactive treatment options? The definition of PTSD, or post-traumatic stress disorder, is a psychiatric disorder that can occur in people who have experienced or witnessed an extremely traumatic event. Next, the definition of mTBI, or mild traumatic brain injury, is a disruption in the normal function of the brain that can be caused by a bump, blow, jolt to the head, or penetrating head injury. Rationale. This ARP project's goal is to research the many effects of PTSD and mTBI among U.S. veterans of Iraq and Afghanistan. In addition, this paper aims to consider new preventative treatment methods to PTSD and mTBI. This topic is an additional importance to me because both my grandfathers served in the Navy. PTSD and mTBI have been proven to be a destructive illness. This issue is of national priority, and the first steps to solving this problem are to inform the public and create awareness for these unfortunate suicide rates. Veterans of the armed forces deserve the best, most technologically advanced treatment that is available. So what are the causes of PTSD and mTBI among veterans? Among veterans of Iraq and Afghanistan, PTSD was caused by an exposure to a very traumatic experience. For these veterans, most common types of trauma exposure were artillery/mortars, gunfire, exposure to human remains, ambushes, knowing someone who has been killed, and finally IEDs, or improvised explosive devices. These results make sense because IEDs have been the most common cause of death or injury among veterans of Iraq and Afghanistan. So what are some of the symptoms of PTSD and mTBI? First, dizziness, headaches, nightmares, flashbacks, fatigue, memory loss, depression, and seizures. So what are some of the effects of PTSD and mTBI? In my research, I found veterans with PTSD were more violent or aggressive. Comparing PTSD positive veterans to the others who were negative for PTSD, veterans with PTSD were 19% more likely to have destroyed property, 25% more likely to have threatened physical violence, 2% more likely to threaten someone with a weapon, and 17% more likely to be in a physical altercation with someone. Overall, veterans of Iraq and Afghanistan with PTSD were more likely to be angry, hostile, and aggressive than other veterans. In addition to being more aggressive, veterans with PTSD are at a higher risk of suicide than the general population. In 2007, a study was conducted to determine the suicide rates of veterans receiving care from the VA and compare those rates to the general American population. This study found that veterans' suicide rates are much higher than that of the general population, even when receiving treatment. Across the board, veteran men and women were at higher risk of suicide than men and women in the general population. A study showed that for veterans, 43 out of 100,000 would commit suicide, and for the general population, 10 out of 100,000 would commit suicide. So what is the impact that PTSD and mTBI has on a veteran's life? To convey the great impact that PTSD and mTBI has on veterans' lives, I'm showing this transcript that is a personal experience and a true story about the everyday long-term struggles that veterans with PTSD face in their lives. In addition, in my research, I have found emotional numbing / avoidance and anger negatively affects familial relationships, and in turn an intensified cycle of emotion withdrawal and retreat for both veterans and their families ensues. This creates a struggle with healing of the trauma. Additionally, emotional numbing and anger can significantly impact the veteran's relationships with his children. What is the best current treatment option for PTSD or mTBI? In my research, I have found one of the most successful and effective treatment options is hyperbaric oxygen therapy, or HBOT treatment. HBOT treatment is the process of lowering and heightening the pressure of oxygen in a concealed space that has many different effects on the brain. Studies show that HBOT treatment has a very positive effect on veterans with mTBI or PTSD. In a study, after 40 treatments of HBOT treatment, the veteran tested recorded improvement in many symptoms including headaches, sleep disruptions, short-term memory, cognition, energy level, short temper, mood swings, imbalance, and 90% of veterans tested stated that after receiving HBOT treatment, they were less depressed than they were before receiving treatment. However, this is a reactive treatment option, and HBOT treatment does not prevent PTSD or mTBI. So what are the possible preventions to PTSD and mTBI? In the past, there have been attempts of delaying or preventing the onset of PTSD after a traumatic event. In the late 1990s, it was thought that immediate psychological debriefing or therapy would be able to prevent the symptoms of PTSD from occurring. Most PTSD sufferers often try to push memories of the event out of their mind and avoid thinking or talking about it in any detail. This method of prevention aimed to force the veterans to confront their memories and beat them instead of ignoring them. After testing, the researchers found that single-session individual debriefing did not prevent the onset of PTSD nor reduce psychological distress compared to the control. At 1 year, one trial even reported a significantly increased risk of PTSD in those receiving debriefing. However, more recently, with the invention of VR or virtual reality, new treatment methods for PTSD have arisen. VR is the use of computer technology to create a simulated environment, and there are currently studies underway that are testing whether or not a preventative treatment method can be found using VR. One possibility includes using VR as an environment where veterans can be exposed to different situations. This treatment method would use 5 steps. A local street with a traffic light, a local street with 2 cars that nearly crash, a fast road with overtaking, accidents without sounds, difficult sights to see, accident with crash sounds, sirens, screaming, glass, and blood. However, before any of this, there would be a one-on-one meeting between the doctor and the patient that included multiple sessions. In the first 2 sessions, not much VR will be involved. The doctor simply tries to get to know his or her patient. In the 3rd and 4th sessions, the rationale for building a trauma narrative is given, and the patient will narrate the trauma using VR components of the environment. In the 4th session, the patient is introduced to the importance of thoughts, and the therapist shows that patient how to record his or her thoughts. Finally, the patient and the therapist work together on thought challenging, discuss the intervention, identify areas the patient should continue to work on, and discuss techniques for relapse prevention. Any questions?